On behalf of the NIOSH Future of Work Initiative, thank you for joining us for today's webinar, The Role of Technology in the Future of Work. My name is Scott Ernest, and I'll be the moderator. Before we get started, I'd like to let our attendees know that the NIOSH Future of Work Initiative, which was launched in 2019, and its corresponding work group have many ongoing and upcoming activities. The initiative launched its webinar series in 2021. The series will have a total of 9 webinars, each focused on one of our future of work priority topics. This is the 9th and final webinar in the series. You can review the recordings on the previous webinars on the NIOSH Future of Work Initiative website or on YouTube. If you'd like to learn more about the series and the initiative, please visit our website. Now I'm going to introduce our speakers. Your first speaker today is Dr. Gary Roth. Gary's the coordinator for the Institute's Future of Work Initiative and a senior service fellow in the Emerging Technologies branch, part of the Division of Science Integration at NIOSH. His research interests are in emerging technologies broadly, and specifically a focus on nanotechnology, additive manufacturing, and artificial intelligence, and how these technologies are changing the nature of work and experience of the future worker. Dr. Roth has been a participant in the Institute's Nanotechnology Research Center, the Center for Occupational Robotics Research, and the Manufacturing Sector Program. Dr. Roth is a graduate of the University of Albany, where he obtained a doctorate degree in nanoscale science and engineering and a master's degree in environmental health and toxicology. The second speaker today is Gavin West. Gavin graduated from the University of Virginia and has a master's degree in public health from George Washington University. He's the director of nanomaterials research for CPWR, the Center for Construction Research and Training, where he has worked for over a decade to prevent occupational illnesses and injuries in construction. Gavin is the author of 2 books on construction hazards and 20 peer-reviewed papers spanning the fields of respiratory physiology, occupational epidemiology, and industrial hygiene. He was a lead author of a study awarded Best Paper by AIHA Nanotechnology Working Group in 2019 and a recipient of the Randy Ogle Paul Barron Award in 2022. He believes in the importance of translating research to practice and works with CPWR colleagues and partners to accomplish this goal. And with that, Dr. Roth, thanks for joining us today. I'll turn things over to you.
Thank you, Dr. Ernest. Before we begin, I'll give you all the mandatory disclaimer, which is anything that I say here is my own current belief. It's not necessarily an official position of NIOSH, the CDC, or any other agency. And if I mention any names, firms, products, or the like, and that's not an endorsement necessarily by NIOSH, CDC, or any other agency either. And as we are dealing with shifting targets in the area of emerging technologies, I will reiterate also that this is my current perspective and may not necessarily hold true at future points. For those of you who are not familiar with NIOSH, thank you for attending the webinar. We here at NIOSH conduct research dedicated to preserving and enhancing the total health of workers. And this is per the charge given to us in the OSH Act of 1970. We also support some other activities beyond research, but the main thrust is developing knowledge to protect workers and helping to implement it. Our role is decidedly non-regulatory, with a few notable exceptions such as respirator certification, mining equipment. Instead, our focus is to provide recommendations, which may then be taken up by employers, workers, and sometimes regulators. NIOSH includes approximately 1,300 staff from Anchorage, Alaska to Atlanta, Georgia. This geographic diversity really matters since the U.S. economy and workforce is just as diverse. For myself, I'm based out of Cincinnati, Ohio. Our staff expertise runs from traditional industrial hygiene to economics to psychology to information technology. And this breadth of expertise is vitally important for a perspective on the future of work. With disclaimers and introductions out of the way, we'll dive into the future of work. We're going to start with the most basic question, which is, what is it? And the future of work is, in fact, quite hard to define because both the future and work defy definition intrinsically due to both their breadth and their relative uncertainty. Are we talking about, when we talk about the future of work, we're talking about the technology that changes on tasks on a regular basis? The use of exoskeletons and algorithms are being more incorporated by the day. Are we talking about the aging and or more diverse workforce? Are we talking about how work is increasingly remote, the relative decline in We've used traditional career work or even contract arrangements for more non-traditional work arrangements. Or maybe we're talking about how workers will need to contend with increasing levels of social disruption, extreme weather, and other hazardous phenomena. It's not any one of these things. It's actually all of these things and more. They have synergistic effects. They're real trends and they build upon one another. And they're all going to result in changes that are felt on every level in work, the workplace, and the workforce. And underneath all that are a collection of drivers and issues that propel us towards the future. These include things like demography, globalization, climate shifts, and more. But maybe it's that I'm a technologist at heart. I see technology as perhaps the most fundamental driver of the future of work. And while it's obviously not an all-encompassing thing, you can hardly blame demographics exclusively on technology, it still ties into nearly every other aspect of the future of work. Information and communications technology has revolutionized organizational design, such as the impact of telework on workplace flexibility. It has also revolutionized work arrangements. Consider the impact of platform-based employment versus contract or career work. The rate of technological advancement also ties directly into technological job displacement, worker reskilling, and by extension, economic security, even if technology continues to make jobs at a greater rate than it obsoletes them. And this is a big if. We will still need to contend with the mismatch between the skills workers have and the skills workers need. This process of catching up will often take years. And meanwhile, both the workers' earnings and the results from that technology will suffer due to deficiency in the labor pool. Some emerging technology industries like additive manufacturing build pipelines to ensure that they have a labor pool with the necessary skill set. In short, the changes of the future of work are highly interconnected, and technology, at least in my perspective, is at the heart of it. So let's take a moment to get a little bit more specific about what technology means for jobs themselves. We'll look at this going through a couple of sectors. In transportation, warehousing, utilities, we have self-driving transportation vehicles on roads and in warehouses. And these are coupled with loading robotics and sensors, which can track everything from humidity levels to worker positioning and productivity. In agriculture, we have self-driving tractors, autonomous grain levelers, cow milkers, and drones that both assess and help tend the fields. In healthcare, we see increasing use of robotic surgery, lifting assistance in nursing, and increasing use of AI in diagnostics. And in services, AI is now used as an analytical tool in nearly every industry, from finances to real estate. It has a growing role in customer service. In programming, the term co-pilot is used both for a particular product, but also in many ways because that AI serves as a co-pilot for the process of developing software. AIs have been writing news articles on many sites for years before the public became very conscious of large language learning models at scale in the last year or two. In short, there really isn't a sector that isn't being impacted by emerging technologies, and from the tools of the trade to tasks to jobs. So what are the specific technologies that we're looking at which are creating change? The most obvious are robotics and artificial intelligence. The implications of these two technologies are myriad and far-reaching, imagining machines being able to take over many tasks which previously required highly specialized and skilled human effort. These technologies have each received their own dedicated treatment in previous webinars in the series, so we're not going to go into them at length. Nanotechnology is another emerging technology which has had subtle and far-reaching impacts. Nanotechnology is a key enabling technology in creating the materials which allowed the development of almost every other technology that we're going to discuss here today. Biotechnology and biomanufacturing have been accelerated by recent advances in gene editing and protein modeling techniques. Beyond pharmaceuticals, materials are being mass-produced or grown, and tasks are now being handled biologically that previously would have been purely in the realm of chemistry. Beyond this, we know humans are biological, and the implications beyond altered biology itself may be profound for the worker, but it's a little bit too early to really speculate on exactly the impacts of that yet. Additive manufacturing, commonly called 3D printing, has long been a tool of product design, but recent advances have made it more affordable for a wider variety of tasks and users. Not only is it in more hands, but it's opening the design of part geometries that were previously impossible or at the very least impractical. It's also transforming supply chains, as its flexibility is very well suited for distributed manufacturing or just-in-time fulfillment. Advanced imaging and modeling techniques have further increased its applications. Clean and green technologies, solar, wind, so on, are transforming energy, but they're also transforming transportation, construction, and more. Advanced computing, information, and communications technologies have created and also obsoleted countless tasks and jobs, and the impact has enabled entirely new approaches to work organization and arrangements. Advanced sensors enable the collection of more data from a wider variety of inputs than ever before, and more cheaply, which is itself a key enabling technology for a lot of other computation-based technologies. And the Internet of Things it enables us to have a finer degree of remote control and coordination of interconnect devices than was ever previously possible, opening a lot of new doors. Before I continue, I want to make two key points. The first is that these technologies are interrelated. Advances in any one of these often feed the others. For instance, advances in nanotechnology enabled advances in computing and sensors, which enabled advances in AI and robotics, which enables advances in additive and biomanufacturing. Second, emerging technology is a moving target. It doesn't necessarily mean recent. Additive manufacturing, nanotechnology, robotics, and horizontal list have actually existed for decades. Emerging is about the innovations in the technology or its applications having a heightened impact on work. Technologies burst onto the scene in this way rather unpredictably as innovations add new applications or drive down costs. While it's hard to generalize about hazards from these technologies, given how diverse they are, a few stand out. First, we're still dealing with health and safety concerns around materials and processes. Aluminum powder additive manufacturing, for instance, is still going to require minimizing the risk for powder inhalation or for fire and explosions. The Internet of Things, the machines that are connected to the Internet of Things are still going to need guarding and other safety features as apply. So this does not necessarily obviate many of things we already know. But what might be different is that some materials and processes are going to be new, and this is going to necessitate more study and precaution. In addition to those things which are brand new, if you will, materials and processes might be introduced in workplaces and workforces with which they are unfamiliar. And this is going to require a lot of adaptation. A good example of this might be biological materials, which might require translating biosafety practice into new work environments for workers of different backgrounds, i.e., just because that the technology is not new and safety around isn't new, putting it in a new setting might require reevaluation of how we approach health and safety. Related to processes is how a worker interacts with the system. A poorly designed interface can pose direct health hazards, such as musculoskeletal risks due to poor ergonomics, eye strain issues due to display usage, and so on. Systems that demand impossible levels of sustained attention or tracking too many items or decision making can also make errors more likely, and these can have other safety and health ramifications. Note that many of these technologies are functionally enabling technologies for algorithms and automation processes, and by extension, changes in work organization. And this can actually make it difficult to disentangle the hazards of that technology itself in specific from the broader context of the future of work. Additionally, many of these technologies are data-driven, with sensors being the most obvious. As more data is captured and utilized, it will be important to protect collected worker data. Data disclosures and breaches can have both direct and indirect effects on workers. Relatedly, information security, which is an expansion of the term cybersecurity, has implications for the safety of the work itself, with breaches potentially causing outages of systems with safety implications. These technologies can also create psychosocial hazards as well. Some may be a result of anxiety over data collection, possible misuse, or from excessive system demands mentally overtaxing a worker, so connected to some of the points we made previously. But that said, it's also not possible to separate the advance of technology from the risk of technological displacement or from the additional mental and time demands of upskilling to keep pace with advancement. Finally, when we think about hazards, we should really be thinking about them in terms of life cycles. You can't view any particular item or at a single point in a vacuum. Each of these technologies are going to have hazards associated, or may potentially have hazards associated with production, the use, and disposal. For instance, if we think about green energy, we'll have hazards associated with producing the parts, the installation and maintenance of the parts, and eventually disposal. In effect, the technology will impact at a minimum manufacturing, construction, and services sectors, and will implicate safety and health for topics as varied as respiratory protection, machine safety, fall prevention, ergonomics, and more. We may not need to reinvent the wheel for most of this, but without a broad perspective, it's going to be hard to gauge the impact of any technology on public health. So I'd like to now take a moment to discuss NIOSH's history with emerging technologies. And I'm going to start this journey with the Nanotechnology Research Center, or NTRC, which NIOSH started in 2004, which was the same year as the US National Nanotechnology Initiative released its first research plan. We realized that if nanotechnology took off as we expected, there'd be a large pool of exposed workers. And we wanted to avoid having potentially millions of workers exposed before exposure limits and established controls were, and before exposure limits were established and controls were developed. And this means being proactive. We also knew that we were going to need an interdisciplinary perspective and that partnerships were going to be key. So we coupled lab-based studies with a very active outreach program and field studies team to gain practical experience on how nanotechnology was being developed and used. And this team helped many early pioneers in nanotechnology safely develop their processes, while we benefited from more robust understanding that helped us to develop pertinent guidance. This guidance ranged from the voluminous tomes supporting recommended exposure limits and controls for carbon nanotubes to the index size reference cards for safe nanomaterial handling. We had products for the regular worker, the academic researcher, and the enterprising innovator. And we think that this breadth and accessibility contributed significantly to our success. In 20 years, we've yet to see an epidemic of nanotechnology-related illness that rivals asbestos or heavy metals. Now, despite nanomaterials being present in nearly every economic sector. And while the NTRC was the first NIOSH center focused on an emerging technology, others have followed. The Center for Motor Vehicle Safety is interested in automation, sensors, and other applications of emerging technology within vehicle safety. One example of a product that they produce related to emerging technologies is a fact sheet on selecting fatigue detection systems. And these detection systems themselves are highly dependent on emerging technologies. The Center for Direct Reading and Sensor Technologies has developed numerous highly accessible and portable techniques and tools from new purchase air sampling to smartphone applications such as the Sound Meter app and Ladder Safety app, which uses sensors built into most common mobile devices. This leverages technological advances to increase worker access to valuable safety resources. The Center for Occupational Robotics Research has conducted testing of exoskeletons, studied human-robot interactions, and drone usage. Though not every emerging technology has its own dedicated center, the desire to mitigate the harms of emerging technology and to find opportunities to employ it for worker health and safety permeates the Institute. Many activities related to emerging technologies are being pursued outside the centers by individual programs. While our work on emerging technologies is diverse, there are some lessons that really seem to echo throughout it. The first is that interdisciplinary approaches are absolutely key. Most of these technologies are very technically complex, and they also have a multitude of applications and challenges. Being able to properly understand their uses, the worker population, the hazards, and the applicable control schemes requires multiple fields of expertise and is frequently a collaborative effort. Similarly, proactive approaches are key to addressing hazards. Many of these technologies are just now scaling up in terms of usage and adoption. Many are still in a phase of rapid technical development and iteration. We know from history that waiting until negative outcomes later materialize before studying issues results in a large number of exposed workers, a high burden to society, and high cost to making existing products safer. Instead, early study can identify lower cost, higher effectiveness interventions. And related to this, prevention through design and similar decision-making models can reduce the risk to workers. Key features of PTD include the dialogue, which involves occupational safety and health experts, workers, designers, and management And such a group brings multiple perspectives together. And this can be absolutely critical when you're dealing with new technologies and techniques where no one individual has a sufficient vantage point to be able to piece together all the implications. Second, moving controls higher on the hierarchy of controls tends to drive down the costs and increase the effectiveness of interventions. And this will result in better outcomes. And these outcomes for workers and the businesses themselves really matter when we're looking to foster responsible development of technology. Partnerships are also key for research. As I mentioned, there is a need to be multidisciplinary. We really want to engage with technical experts in a technology and maximize the relevance of research and recommendations. Even more important is access to the technology itself. With the diversity and rate in advance of emerging technologies, no one could support labs devoted to every single aspect and area of interest. Partnerships give us the chance to study the technology as it's being developed and used, providing practical insights while also better utilizing available resources. Additionally, opportunities really abound for positive uses of these technologies. While occupational safety and health as a profession often focuses on new or increased hazards, many of these technologies provide opportunities to reduce risk. Consider the ability to work remotely and away from dangerous processes, or improved exposure assessment from sophisticated sensors, developing safer materials and processes for making them, or improved decision support for control strategies. All of these and more can be enabled by these new technologies. And finally, success means being both aware and adaptive. The technologies at play are changing all the time, and the hazards, risks, and opportunities may be in very different forms than what we traditionally study. So we need to keep an eye on industry and also be ready to innovate in our study design. To sum up, the future of work is driven by technology, and the innovation that will shape the future is happening today. And while it's still early days and impact may be downstream, we cannot wait for it. NIOSH will continue to pursue research that will help ensure the responsible development of these technologies and help to safeguard the American worker now and into the future. I want to take a moment to acknowledge my colleagues in the Emerging Technologies Branch, the NTRC, and all the other NIOSH centers and programs who have made contributions to these efforts. And thank you all for listening. With that, I'll turn it over to Mr. Gavin West from CPWR.
Thank you so much, Dr. Roth. I'll pull up my slides. And I thought you did an excellent job. There's so much to unpack with this topic. It's very broad, the future of work, but I thought you did a great job of giving a very comprehensive overview of the important concepts and trends that are shaping in terms of how technology is shaping the future of work. So for this portion of the talk, I'd like to hone in a little bit and look at the construction sector. And I think that technology, as Dr. Roth mentioned, is a very important driver of change and innovation. And I think that construction is also very emblematic of change itself by its very nature, which was the reason I chose the title for this talk. Construction is change. Here's a disclaimer that's very similar to the one that Dr. Roth mentioned at the beginning of his talk. And just for a quick primer on my organization, CPWR, the Center for Construction Research and Training. We've served as the NIOSH-funded National Construction Center since 1990 through a series of cooperative agreements. And we are a nonprofit organization created by North America's building trades unions. I encourage you to learn more by visiting our website. You see a screenshot here at cpwr.com, or to learn more about the National Construction Center on the CDC website. CPWR's mission is to reduce occupational injuries, illnesses, and fatalities in the construction industry. And as shown in this diagram, our NIOSH-funded research programs work hand in hand with our training programs funded by the Department of Labor and National Institute for Environmental Health Sciences, as well as our medical screening program. I've been fortunate to work with this dedicated and skilled team of professionals that we like to call our Big Nano team. In particular, I'd like to acknowledge Dr. Bruce Lippy, who is a longtime mentor of mine, a close colleague who still works with our team and was the founder of our nanomaterials research program, which I'm currently directing. I have many other great colleagues shown on this slide, and I did not have a good picture of our good friend and colleague, not pictured here, Bill Cajola at MS. So after this webinar, you should be able to, one, describe factors affecting the growth and adoption of technology in construction, and two, you should be able to explain key findings from NIOSH-funded extramural research on emerging technologies in construction. Historically, the construction sector has been slow to adopt emerging technologies. As it turns out, ancient civilizations were pretty good builders and material scientists. The Colosseum in Rome is almost 2,000 years old, and even older structures can be found around the globe. Building materials and methods used centuries ago are still being used today, but technology is beginning to have a greater impact on how we build our world, as well as those who build it, including their health and safety. Investment in architecture, engineering, and construction technology is accelerating. So these estimates from the McKinsey Global Institute show that funding for this type of technology nearly doubled during the 3-year period beginning in 2020 compared to the 3 years prior. So note that the figures shown here are in billions of dollars. Supply and demand imbalances are fueling technology growth in the construction sector. So currently we're facing a pretty severe labor shortage with over 400,000 job openings in the construction industry in the US as of February of this year, according to the Bureau of Labor Statistics. That is coupled with quite strong demand for construction globally, partly due to the infrastructure packages shown on the slide with a $1.2 trillion infrastructure law passed recently here in the US, as well as 800 billion euros dedicated towards infrastructure in Europe. The pandemic, coupled with an aging workforce, contributed to these skilled labor shortages. So this is from an interactive data dashboard developed by the CPWR Data Center. And you can see, I like this chart because it shows a lot of different things. For one, it shows that the US working population overall is aging. And we see that even more so for construction workers on the orange line, which on average are older than workers in other industries. And workers have been getting older over time, but we see around the time of the pandemic a decrease in the average age, reflecting retirement and workers exiting the industry, especially workers 55 and older in construction, were more prone to leaving. And it's worth thinking about the effect of that loss of institutional knowledge of these experienced workers and how that relates to safety and health. One response to the labor shortage has been to recruit more women to work in the trades. So women make up nearly half of the US labor force, but account for only 17% of blue-collar workers and roughly 11% of construction workers, although the latter number has been steadily increasing or gradually increasing over time. To address the gap between supply and demand, contractors are also increasingly looking to technology to boost productivity, safety, and health. CPWR administers the Liberty Mutual Safety Innovation Award in Construction, which was awarded in 2022 to DPR Construction and the Canvas robotic drywall finishing tool shown here. So this robot leverages several emerging technologies to eliminate multiple passes of finishing, which improves productivity and efficiency. And it also mitigates risks associated with working in height, dust exposure, and repetitive motions. And you can see in the bottom left, it also uses artificial intelligence, machine learning, and LiDAR 3D technologies. So LiDAR stands for light detection and ranging, sometimes called laser scanning or 3D scanning, and essentially uses laser light reflection to measure distances between objects to generate 3D maps. This slide, courtesy of Dr. Scott Ernest, shows how automation has already been occurring in construction for quite some time. Maybe not as in not such a technologically advanced manner as the previous slide, but using the power tool shown here with an extension handle to tie rebar instead of pliers was shown to be twice as fast and reduced awkward postures that contribute to low back disorders. Construction lags in digitalization relative to other industrial sectors, but technologies offering a competitive advantage are accelerating change. Construction is a very dynamic industry and it can be quite complex. We have mixed crafts, multi-employer sites, changing environmental conditions. Work sites themselves are variable, and you can have some very large-scale projects involving many years and huge sums of investments. Excuse me. Digitalization can benefit safety and efficiency, a win-win, by improving communication, planning, coordination, as well as data collection and analysis. So I've highlighted communication in red here on this slide because it's shown in work conducted by my colleague, Dr. Linda Goldenhar, to be a very important piece of building a good safety climate at construction sites. So Dr. Goldenhar has really done some excellent work in measuring safety climate, looking at the indicators of a good safety climate and how to improve them. And there is this overlap between productive firms and safety. CPWR has partnered with Dodge Construction Network since 2012 to conduct the biennial Construction Safety Management Survey. 298 contractors participated in 2023 from a panel Dodge maintains across the United States. Excuse me. Roughly half were larger companies like large general contractors or design build firms, and the other half were specialty trade contractors. Survey respondents cited safety and productivity as the main reasons for using technology. Although increasing sustainability and decreasing reliance on labor were also viewed as important, especially among large firms, which are shown in the lighter blue bar on this graph. The report also presents a case study to describe how Rosendin, one of the largest electrical contractors in the United States, embraces technology to build a data-driven safety program. Aside from extensive data collection and analysis, the company uses QR codes in a pretty innovative way, I thought, to access information about proper tool use, as well as information about job hazard analysis, or JHA, as it's commonly referred to in the industry. They also use reality capture and AI-powered analytics to create interactive digital 360-degree views of projects, which is becoming more common, and a lot of interesting technologies involved with that type of approach. And they use virtual reality training for lift operators, as well as a company app to share safety resources. Now, this slide, courtesy of Dr. Scott Ernest, helps to illustrate how various technologies can be used to improve operations as well as health and safety. Technologies shown include prefabricated materials, sensors, wearable technologies, robots, and technologies to enhance collaboration and communication. And so this was from a conference in 2016. And so I think we're seeing a lot of this is starting to come to pass and continuing to shape the future as well. I'll pose this question, rhetorical question, to you as an audience. Will the uptake and impact of technology be distributed evenly throughout the industry? Moreover, will technology exacerbate existing health inequities? Consider that construction is dominated by small employers. Over 80% of firms have 10 or less employees, shown by the orange slice of this pie chart. More than 90% have less than 20 employees, if you look at the orange and the blue slice together. Firms with 100 or more employees represent just 1% of all establishments, but it's important to note that they employ roughly 30% of all workers in the industry. Small construction establishments experience higher rates of fatal injuries. So firms with less than 20 employees are represented by the red line on this chart, And as you can see, over a period of many years, the rate has consistently been higher among these types of firms compared to mid and large size employers. Small firms were also the least likely to use emerging technologies in the Dodge 2023 survey. The majority, 55%, said they were not using any of the emerging technologies asked about in the survey. Conversely, the majority of large contractors were using these technologies, as well as mid-size. Large firms are more likely to collect and use safety data. So we see on the chart on the left that there's a clear trend of increasing percentage of firms that were gathering safety data from small to mid to large. But one thing that was common among all the types of firms was that a fair amount said that they collect data, but most goes unused. The larger firms were more likely to use the data effectively. But I think this is not unique to the construction industry. As Dr. Roth mentioned, sensors and other technologies are increasing our ability to collect large sums of data, and there's a real challenge in being able to make use of it all. So I think that's one area where artificial intelligence and machine learning can really help to make better use of data that's being collected for the purpose of improving safety programs. BIM, drones, and laser scanning were commonly reported technologies in the survey. So building information modeling in particular was used by roughly half of firms at both of the time points compared here, 2021 and 2023. And I would note that this question asks about specific technologies, so inferences shouldn't be drawn about how commonly other technologies are used that are not shown here. Aside from these three big ones, we see remotely controlled equipment, predictive analytics, virtual reality training being used, as well as wearable sensors, robotics, and exoskeletons. So let's pause for a quick recap. What are some of the main points that we've covered so far? One, construction technology investments are accelerating and quite a rapid pace in recent years. Two, productivity, safety, and sustainability are important drivers of technology use in construction. And three, smaller construction firms are less likely to adopt new technologies, which could widen existing disparities. So that's, I think, something that is underlying or is important to think about in a lot of different contexts as we discuss technology. Let's move on to our second objective and explain key findings from NIOSH-funded extramural research on emerging technologies in construction. Engineered nanomaterials are used in multiple industries, so understanding the risks they pose to workers, excuse the typo, is critical. NIOSH has published 3 recommended exposure limits in these current intelligence bulletins shown here, and you can access some of the other nanotechnology publications that Dr. Roth referenced in his talk at the URL here. So CPWR has documented quote-unquote nano claims for over 900 construction products to gain a better understanding of how nanomaterials are used and in which types of applications. So this information is primarily derived from manufacturers and distributors of these products, and you can learn more by visiting the inventory online at the URL shown here. My colleague Sarah Brooks typically uploads new content to the site weekly. So you can go and look at individual products, learn about the applications, learn about the benefits of the or the properties of the nanomaterials that are added. There's also a news and related information section, a lot of good information. And we have an interactive dashboard that allows users to explore the data through charts. And so you can look at the most commonly reported nanomaterials in the inventory, including nanoscale polymers, silica, graphene, different types of metal oxides, as well as looking at nanomaterials used by specific trades. So in terms of products, paints and coatings account for more than half of the inventory. We've clearly, that's been one of the very important applications in construction. Others we see include cement and concrete, insulation, and lubricants. So CPWR is measured exposures to engineered nanomaterials, which I may abbreviate in subsequent slides as ENMs, during common construction tasks. So here's a test chamber where we've conducted some of our studies, and we've used traditional industrial hygiene methods with filter-based sampling, as well as electron microscopy and more modern instruments like the particle counters shown here. The research in general shows that engineered nanomaterials tend to remain embedded in the construction materials to which they are added. So on the left, we see nanoparticles suspended in larger paint spray droplets from one of our studies, as well as sanding debris containing white nanoparticles. CPWR studies have also found release of free engineered nanomaterials in some instances, although this is less common, and potential to exceed NIOSH recommended exposure limits while spraying paints and coatings. So in this study, we were looking at on the right, cutting, tuck pointing, and grinding of cement and concrete and mortar, and found release of graphene, a 2D nanomaterial, where the material was not bound to the matrix. And we see other tasks that we've examined, including spraying and sanding, cutting, nailing, and drilling of roofing tiles. And a key message that we emphasize from our work is that engineering controls used in construction are effective in reducing exposure to engineered nanomaterials. So we have the hierarchy of controls from most to least effective, top to bottom. And here on the right, we show some of the types of engineering controls we've studied, including local exhaust ventilation and dust suppression using water. And we've shared this information with the trades through toolbox talks like these that are designed to be delivered on the job site based off of the studies that we conduct. We've also developed and delivered training materials through a train-the-trainer approach that explain how respirators offer effective protection against nanoparticles. So the training actually goes through all the levels of the hierarchy from the top to bottom with the most to least effective. And participants have really enjoyed this video that we show explaining how the filtration process works, because it's often counterintuitive when you think of filters capturing these tiny particles, but they are indeed very effective. So partnering with NIOSH and skilled trade professionals has been instrumental to our work. So on the right is working with skilled trade professionals at the International Masonry Institute. We also had NIOSH colleagues from Health Effects Laboratory Division were there, and they've joined us with on other studies that we've worked with as well, and used measurements as well as samples from our studies in their toxicological investigations. And so that's been really important to understand potential health effects from occupationally relevant exposures. And I was very excited to see some of the work presented just last month. Here's a poster session from some of our colleagues that they presented at the Society of Toxicology. And they actually presented 2 poster sessions on the work that we have done together. And in this case, where we were looking at nano zinc oxide, it was good news for workers that the levels of exposure we were measuring did not seem to elicit acute toxicity in vivo. Now, CPWR has an ongoing research project on exoskeletons led by researchers at the University of California, San Francisco and Virginia Tech. I've included links to 2 webinar recordings where you can learn more about these devices. And just published this month in Applied Ergonomics was a new paper by this group, and I've included a link here and a quote. The use of exoskeletons has the potential to be accepted as an intervention to reduce work-related musculoskeletal disorder risk, expand accessibility to construction jobs, and even enhance performance. Another important finding was that perceptions about the barriers to using this technology differed by demographic factors. So more specifically, females and non-white workers perceived higher barriers to using this technology, which has implications for how we communicate, roll out these these types of technologies and how we train workers. CPWR initiated the Small Study Program in 1993 to provide seed money to investigate promising new research initiatives. So this allows for funding up to $30,000 for 12 months, and there have been 143 studies awarded with priorities defined by NIOSH strategic goals and the National Occupational Research Agenda for Construction. And so in this list on the right, we see of recent small studies, we see a lot that address emerging technologies, including drones, intelligent hearing protection for construction workers. And so I think that this program is really well suited to studying emerging technologies, given the nature of its scope and the funding and its ability to respond to things that are coming out as we go along. And so here's an example of a study entitled Using Unmanned Aerial Systems for Automated Fall Hazard Monitoring in High-Rise Construction Projects. So unmanned aerial systems is another way of referring to drones. And this study found that the proposed automated fall hazard recognition system could facilitate recognition of guardrails in high-rise construction products. And this slide is courtesy of CPWR's Deputy Director, Dr. Rick Ronhart. Here's another example of a study entitled Protocol for Assessing Human-Robot Interaction conducted at the University of Alabama. So this study developed a practical process and tools for practitioners to identify and quantify human-robot interaction safety risks when using robots and automation in construction operations. This example, entitled Embedded Safety Communication System for Robust Hazard Perception of Individuals in Work Zones at UNLV, was a very interesting one. And the results of the study indicate that tactile signals transmitted with the system, which is a prototype, can communicate hazards to workers, especially in harsh environments where workers' innate sensing is limited. I would note that those interested in work zone safety technology might want to consider registering for another webinar at 2 p.m. Eastern today on developing and enforcing internal traffic control plans. So if you search for CPW webinar series, you should find that one right at the top of the list. Additive manufacturing, also known as 3D printing, is beginning to take a foothold in the industry, but the health and safety hazards are still not very well understood. I would say that NIOSH has a lot of very good intramural research on hazards and controls for 3D printing. And I would like to conclude today's talk about the future on a positive note. So I had a very interesting discussion just last week with a researcher, Professor Feeney at Arizona State University. So her group is looking at the toxicity, other types of toxicity not yet studied for asphalt fumes, which are a known carcinogen. And so that's part of their research, is looking at the toxic effects, but they're also looking at an alternative asphalt binder, which is actually a bio-based material, this iron-rich biochar, which when incorporated into asphalt can benefit not only workers, but the public by reducing exposure to volatile organic compounds. So as Dr. Roth mentioned, possibilities for improvements in safety through technology abound. And I thought this was a really interesting one in terms of material innovations. So thank you very much. And I think now we are going to open things up for questions and comments, and I'm going to stop sharing my screen.
Great. Thank you, Gavin, and thank you, Dr. Roth. We appreciate your informative presentations. We have just a few minutes now for Q&A. So if there are participants that have any questions, feel free to go ahead and enter those into the Q&A box, and we'll try to answer those. In the meantime, I have a few questions I'll just touch on, and we'll go from there. So my first question is, and this is really for either, but what are the most promising technologies for reducing injuries and fatalities in the construction sector? I mean, obviously the sector is a very hazardous sector. There's a lot of, injuries, the focus 4, that sort of thing. There's also a lot of issues with opioids and suicides and the impact on workers and their families. So are there specific technologies that you think could particularly, really make an impact on getting those numbers down?
I'll go ahead. I'll go ahead and talk in terms of the construction sector. And I think that, there's maybe no one technology. It goes back to what Dr. Roth was saying in terms of how these are all very interconnected. So I think, it's going to be one of these cases where the sum is of the whole is greater than the sum of the parts, excuse me. But, maybe some that I would highlight where there's really a lot of promises, wearables and sensors for increasing the amount of data that we can have in real time, and connecting that through the Internet of Things, for being able to have a much better idea of what's happening on a construction site. And that ties into this idea of digitalization and creating these digital twins of construction sites. So just the ability to really kind of monitor what is happening on a site, as well as safety trends in the long term, I think could have a really big impact on the industry, coupled with things like artificial intelligence and machine learning to power them.
I would venture to add a little bit to it, because I think you mentioned opioid usage and suicides, and we do know that there is a link between those and musculoskeletal disease. And that there are opportunities for emerging technologies such as exoskeletons and their use to reduce the burdens of those diseases. So while I have not researched the specific area, that would be one that I would be inclined to keep my eye on.
Yeah, great. Thanks for that answer from both of you. Really interesting, and it's great that there's a lot of work going on in those areas to move the ball forward. Looks like we do have a question in the Q&A chat, and I'll just open this up to either of you. It says, are there some ways that technology is enabling reuse of real estate more economically that may encourage reuse versus clearing new land?
So what I can say is that we do know that that various emerging technologies that have allowed new approaches to work arrangements such as telework have reduced the amount of demand for certain types of office space and things like that. As for how those areas are being reused and repurposed, I can't really, I'm not really an expert on that, but it would stand to reason that this would create opportunities to redevelop in different ways.
Okay, great. Thank you for that response. There's another question that just came into the Q&A, and it is, when technologies are being developed to address efficiencies, such as automating equipment, how or where do safety researchers have an opportunity to evaluate the impacts on safety? And I mean, I can go ahead and take a crack at that to begin with. I mean, we have, we set up the Center for Occupational Robotics Research. So that's really kind of what they're doing. They're looking at technologies. They're working with manufacturers of some of these new technologies and evaluating it for the impact on safety and health. So that's really, as well as I think the whole Future of Work initiative, it's looking at the technologies and really trying to determine what are the positive impacts of those technologies and what are the potential negative impacts resulting in increased hazards. Hopefully we can leverage the technology to have the most positive impact it can on the workforce.
I agree with that. I'd add that partnership, that this is a very good example of why we view partnerships as so essential, because finding the partners who are using automating technologies in this way are really what would provide us the opportunity to do a lot of those kinds of studies.
Okay, thank you. Any other questions? Let me ask another one here. This is to Dr. Roth. You talked about the start of the NTRC, which was approximately 20 years ago. And I was just curious, is there still a need, and how does that topic compare to other priorities for the whole Future of Work initiative, the nano versus other areas? Because there's a lot under that umbrella.
I think that's a very good question. So, so one of the things that we often discuss is a question of when does something cease to be emerging, and it can't really strictly be a question of age, because that to some degree it's about when you're feeling a change in the nature of work, the workplace, and the workforce as a result of it. So a good example for that is additive manufacturing has been around technically since like the 1970s, but it's really blossomed in impact in the past decade or so. So in terms of nanotechnology, there's a couple of different aspects to it. First, it is a congressional priority, so investment in that is considered national priority for that reason. But beyond that, we also have a constant flow and development of new nanomaterials and new applications for them all the time. And as long as these materials represent new toxicities, new applications, new workforce that are exposed, that's going to create a demand for more research into those new processes and materials and applications. How that measures in terms of versus other priorities. Well, in the future of work, we've got a large number of other priorities now, so the competition is of course stiffer, but that doesn't mean that now nano has ceased to be a priority. It just means it's competing with a lot of others.
Okay, great, thank you. Let's see, we got just a couple minutes left. Let me ask one other question. Well, here's one that just popped in. Let's see. Are you seeing any particular trends or changes in public attitudes towards biomaterials?
I'm not familiar with any public opinion polls or data on that particular technology, unfortunately.
Neither am I.
Okay, thank you. And then let me just ask one other one, and then we can finish up. But in terms of CPWR and the work that's going on at CPWR, this is really for Gavin. Can you just say a little bit about the amount of energy or resources that are being put on the substantial existing hazards like the Focus 4 of falls struck by caught in between electrocutions versus the future of work and these technologies and their impact?
Yeah, I think that's a great question. And construction is a very hazardous industry, and we have existing issues, long-standing issues that have been very tough to tackle. Falls, falling off of buildings, and that's been a very persistent and serious problem. So, at CPWR, we maintain a balanced portfolio. I think it's important to keep an eye towards the future and have that as part of the work we're doing. But by no means are we neglecting, hazards that we've been dealing with for a long time and making strides to improve. So I think that probably we would lean more towards, if I look at our current projects, we have, roughly a dozen, I think, active research projects, our larger ones. And two of those are that I highlighted today, our nanomaterials research and exoskeletons are kind of looking at issues that are shaping the future, considered emerging technologies. Whereas the others, have some aspects of that, but I think are maybe more focused on traditional hazards in the industry. And I mentioned our small studies program gives us a lot of flexibility to look at different priority topics as they emerge.
Okay, with that, I just want to thank everybody for participating. Thanks to both of our speakers, Dr. Gary Roth and Gavin West, and hope everybody else enjoys the rest of their day. Take care, everyone. Bye-bye.